So hi everyone, welcome to the Beauty of the Nile Skin Health and Beauty Conference. My name is Jasmine Mobley, creator of the Beauty of the Nile community and podcast, and your moderator for today. Beauty of the Nile is for and by women of color to celebrate and highlight our skin's beauty in all its shades of brown. The focus is to share information on how you can best care for and love your brown skin. We highlight expertise from women of color, dermatologists and estheticians, and real women like you and I, and we're here to really elevate our voices and experiences. Growing up, I didn't feel like there was enough positive conversation around skin of color and how to best care for it, how we treat it, and how we love our brown skin in all shades. So I wanted to create space for this through beautyofthenile.com and the Beauty of the Nile podcast and community on social media, at Beauty of the Nile on Instagram, and now through the first ever Beauty of the Nile Skin Health and Beauty Conference. And I'm so excited that you're here with us. So I want to give you guys a quick overview of what you can expect from today's event. I'll start by introducing each of the awesome panelists. As you can see, we have some amazing estheticians and dermatologists here with us today, and they're really the best of the best when it comes to skin of color. So we're so lucky to have them. After the intros, we'll dive right into the meat of the conference, which will consist of the awesome experts answering your biggest skincare questions. We received tons of questions, and we'll go through them, providing you with specific tips and tricks from these experts. At the end of the conference, we will announce the winners of the contest who will get a free 20-minute skin consultation with one of our expert estheticians, either Allie Dawson, Jasmine Lewis, or Sylvia Brownlee. Something like this would normally cost hundreds of dollars, so the chance to win it free with these all-stars is just amazing. So now I'm going to kick it off and introduce the panelists. So first off is Allie Dawson. Allie is a New York City-based esthetician and creative. Her introduction into skincare began while she was working as a professional actress. While working as an actress, she discovered that most makeup artists did not know how to properly work with her skin, which resulted in her having to create and mix match her own makeup for every production. So, the heavy, cakey, mix match makeup, which oftentimes contained harmful ingredients that she had to wear for her shows, obviously did not leave the best skin canvas. So she decided to turn her desire and passion for fixing her own skin into a career helping others take care of their skin as well. As an esthetician, she's performed thousands of facials with a focus on treating acne and hyperpigmentation. And Allie believes that with the right routine, product, and guidance, great skin is possible. Next up is Dr. Diane Davis. Dr. Davis is a Houston-based, board-certified cosmetic dermatologist. She is a fellowship-trained cosmetic dermatology and laser surgery. She specializes in non-invasive facial rejuvenation, skin of color, hair loss, and cosmetic surgery. Dr. Davis received her medical degree from the George Washington University School of Medicine in DC and was awarded the Walter F. Rosen Award for Outstanding Student in Dermatology. Dr. Davis completed her dermatology residency at the University of Oklahoma. While in residency, Dr. Davis was influential in coordinating the first Skin of Color Symposium, helping to promote awareness of the unique features of skin of color. She's authored several journal articles and textbook chapters and is co-founder of Sunblock Kids, which helps to bring awareness about the importance of sun protection at an early age. She was previously an NFL cheerleader for the New Orleans Saints. Next up, Dr. Hope Mitchell. Dr. Mitchell is an Ohio and Michigan board-certified dermatologist and the founder of Mitchell Dermatology. She got her medical degree from the Medical College of Ohio. She also completed a residency in dermatology at Henry Ford Hospital in Detroit. She's dedicated to patient-centered care and education. She has extensive experience in general dermatologic treatment, acne, hair loss, eczema, and hyperpigmentation treatment, as well as skin cancer diagnosis, treatment and surgery, and cosmetic injectables. Dr. Mitchell is an advocate for mentorship, education, and diversity in medicine and dermatology. She is a wife and mother of 4 children. She enjoys ministry, fitness, gardening, antiquing, traveling, spending time with family, and serving the community through annual free skin cancer screenings. Now let's meet Dr. Karen Kaga. Dr. Kaga is a dermatologist and cosmetic and laser fellow at Massachusetts General Hospital and Harvard Medical School. She's passionate about redefining beauty standards to be more accepting of all types of beauty. Dr. Kaga wants to create a safe space where everyone feels welcome, seen, and inspired to shine their inner light unapologetically. Next up, Jasmine Lewis. Jasmine is an Atlanta-based esthetician and founder of V Beauty, a destination that specializes in luxury beauty services and targeted skincare treatments. Jasmine graduated from Clemson as pre-med with a biology degree and from Elaine Sterling with her esthetician's license. Jasmine specializes in luxury beauty services such as lash extensions and targeted skincare, teaching women of color how to care for their skin. V Beauty recently launched its first product, a luxurious hydrating rose water. Jasmine enjoys spending time with family, friends, and her precious Shih Tzu. She's a lover of all things creative, enjoys the beach, museums, hiking, walks in the park, art, and trying new restaurants. So now let's meet Dr. Kavita Darji. Dr. Darji is a dermatology resident. She's worked as a clinical research fellow physician, as a sub-investigator on multiple dermatologic clinical trials, and has been seeing patients in dermatology clinic. Dr. Darji has an impressive academic background and has completed medical school and graduated summa cum laude from college. Next up is Kimberly Harris. Kimberly is a licensed esthetician with a passion for all things beauty. She's focused on educating clients on proper skincare tips and helping them to incorporate non-toxic, clean beauty regimens in their daily beauty and wellness routines. Kimberly brings over 12 years of beauty experience, specializing in skincare for all ethnicities, and has trained with some of Washington, D.C.'s most skilled professionals. She believes that when you look good, you feel good about yourself. Kimberly's passion and desire led to the creation of her mobile beauty brand, Beauty Calls DC. And she also has a skincare line launching soon focused on anti-aging. So now let's meet Dr. Pooja Rambia. Dr. Rambia is a dermatology resident physician at the Zucker School of Medicine at Hofstra. During medical school, she pursued a year-long pre-doctoral research fellowship funded by a competitive grant award from the American Skin Cancer Association and the National Institute of Health. She's passionate about using social media to educate and empower the public on topics ranging from skin health to love for all skin tones. Next up, Dr. Tia Paul. Dr. Paul is a Harvard Medical School trained dermatologist based in Orange County, California. Dr. Paul grew up in a small town in India where she never imagined she'd leave, but she had dreams of becoming a doctor. That dream motivated her to move to the US, where she began college at Franklin and Marshall College. She then went on to pursue a biomedical engineering degree at Cornell, where she met her now husband. She figured out that dermatology was her calling and completed her dermatology residency at the University of Miami. She currently practices in Southern California, where she lives with her growing family and super cute little daughter. Her clinical interests range from general dermatology to surgical procedures, and she's particularly interested in skin of color, especially among South Asians. Her goal is to raise awareness of skin conditions that are often neglected. Now let's meet Sylvia Brownlee. Sylvia is a licensed esthetician, cosmetologist, and founder of Pure Beauty Skin Bar in Cincinnati, Ohio. Growing up, Sylvia had dreams of making a difference within the beauty industry. Upon graduating from cosmetology school, Brownlee started her career in a high-profile salon, ultimately becoming the director of education at a renowned skincare institution. It was there that she discovered her passion for enhancing the lives of those who suffer from acne and hyperpigmentation. In 2015, she took the leap of faith in founding Pure Beauty Skin Bar with the purpose of teaching others how to love and care for their skin. Along with in-house treatments at her Luxe Spa, Sylvia has extended her knowledge to service the needs of clients nationwide with a line of high-performance skincare products. And last, but certainly not least, meet Dr. Tiffany Clay. Dr. Clay is a board-certified dermatologist. She received her bachelor's degree in biology at Dillard University, where she graduated magna cum laude. She received her medical doctorate at Meharry Medical College. Dr. Clay completed her dermatology residency at St. Louis University, where she served as chief resident. She's been living in Atlanta for over 20 years and deems herself a part-time foodie. She enjoys cooking and trying new cuisines and is passionate about fitness, travel, and spending time with her husband and family. Dr. Clay will actually be joining us shortly, but in the meantime, we'll go ahead and get started. So we're gonna just jump right into the questions. So Dr. Mitchell, this one is for you. Somebody wrote in and asked, how should we address body pigmentation and scarring or stretch marks on dark skin? I think you're on mute, Dr. Mitchell.
Thank you.
Yeah.
So I'd like to say hello to everyone, and I'm very excited to be here. And in answer to the question, when we have body pigmentation, it can be a challenge. And, you know, we think of it from head to toe. And so what we like to do when we're faced with hyperpigmentation is we like to find out what the cause of the pigmentation is. It's really important that we start there. We don't just want to jump into cleaning up the pigmentation if we don't know why it's happening. And if we can stop why it's happening, then we hope that we can prevent future hyperpigmentation. Now, if we really are talking about the body itself, I like to start out with body washes that may have glycolic acid in them or salicylic acid, something that's going to help to exfoliate and to remove the outer layers of skin, so that when we apply body lotions, such as lotions that contain glycolic acid, they can penetrate and they can be very beneficial. And that would be the same on the face as well. In terms of scarring, in terms of stretch marks, what I find works really well, especially in skin of color, is a procedure called microneedling. And microneedling is a treatment that I use in my office. I also use radio frequency, but that treatment has heat associated with it. And so we have to be very careful when we use that treatment on skin of color. And so I tend to use a lot of microneedling, and I find that multiple sessions can be very productive in combination with using a treatment plan.
Okay, awesome. Those are really great answers. Thank you. And the next question, someone wrote in, and I want to direct this to Allie and Kimberly. I'm going to ask you both to weigh in. What are some of the safest peels for dark skin? So Allie, if you could weigh in first, maybe some of the things, I know you offer peel kits for some of your clients and work with people that way. So can you talk about what you tend to recommend for darker skin?
Yeah. So hi, everybody, by the way. My favorite things, it kind of depends. Enzymes, I think, are great for everybody. They're really safe. They're not going to be too irritating. Lactic acids can also be really good, glycolic as well, depending on the percentages. Obviously, if you're going for more of a professional chemical peel, the safest, that in my opinion, would be TCA peels. They're going to be fully colorblind. You're not going to get any fear. You really just want to be careful when it comes to Jesner's and salicylic acid peels, as that can potentially lead to hypopigmentation, which is a whole other can of worms. So really, if you're going to stick to professional peels, TCAs tend to be the safest for any skin of color. While at home, you know, those personal at home facials, enzymes are probably my favorite. Anybody can do those.
Okay, awesome. So enzymes, because regular people can handle those, but the rest come to you guys.
They work like little Pac-Men. They just kind of eat the dead skin off the surface, and it'll leave your skin super buttery. And you're not really going to have to worry about any extra irritation, as they're really great for sensitive skins.
Okay, awesome. Awesome. Thank you. And Kimberly, can you weigh in about some of the peels that you use for your clients in your practice?
Hello, everybody. So previously with my clients, I was dead set on enzymes and glycolic peels. Just as Ali stated, enzymes are safer to use, and they're great for first timers too. And depending on what the goal is for the treatment determines how often we would do the actual treatments. But my biggest thing is to let clients know, don't buy online. And definitely be under the supervision of an esthetician or dermatologist when you're trying to figure out what type of quote unquote pills that you can use at home. But for me, I love enzymes and I love glycolic pills. They are safe. They've been safe for me to use, and they've been pretty effective. But definitely be under the supervision of an esthetician or dermatologist, please.
So don't go rogue and start doing whatever I found on the internet or something.
Yeah,
okay, good advice.
Don't do that.
Okay, awesome. So the next question I'd love to ask Dr. Kaga, this one. Somebody wrote in and asked, can 30-year-olds or 30-year-old skin use anti-aging products on their skin?
Hi, everyone. Happy to be here today. I think that's a great question. I would say absolutely. I think it's a great time to start. In fact, I think getting an early start in anti-aging is probably one of the best things that you can do to your skin, because then you'll be chasing your tail down, down the road anyway. So for me, the most important thing is sun protection, starting off with sun protection and really protecting your skin from any damage from UV rays. Anything that we talk about today in terms of reversing the natural aging process, you want to make sure you're protecting all of that work that you've done by protecting against the sun. And then retinols or retinoids is also going to be one of the most important bread and butter anti-aging products that I think everyone should add to their regimen as long as you're not pregnant or breastfeeding. It just really helps with cell turnover, fine lines and wrinkles. And then, when we get to talking about hyperpigmentation, sometimes it can lift some of that superficial hyperpigmentation in the skin as well. And then antioxidants, making sure you've added that to your regimen is also going to help reverse some of the damage and protect against future damage as well. And then, to kind of wrap that up, consistency is going to be very important. It's going to be key. Anything we do in terms of treating the skin is not going to happen overnight. So just make sure you get a regimen that you can stick with. But yes, definitely get an early start on all of that.
Okay, awesome. So consistency and never too early to start. So that's great.
Yes.
So Dr. Davis, I want to direct this next question to you. So someone asked, what are some benefits of dermal infusion? And I think for people who may not know what that is, maybe you can start off by saying what dermal infusion is and then saying what are some of the benefits of it.
Okay, hello everyone. I'm happy to meet everyone and be part of the conference. So I am not 100% familiar with dermal infusion myself. So I actually had to do a little bit of research. But for those who may have heard of hydrofacials or something like that, I believe dermal infusion is similar to that. And so I may actually have some of the estheticians weigh in. But it's a treatment that can kind of help to cleanse your skin. It can help to clean out the pores. And then you can actually infuse certain products back into the skin to help either with just overall skin brightening. It can help, I think, a little bit with acne. It can help to kind of cleanse and clarify the skin. But these are going to be, it's a procedure that's done in the office, I think usually by an esthetician or someone that's been trained to do them, where it's a little device that actually kind of roll over the skin, or kind of drag across the skin, if you will, that kind of helps to, again, clean out the pores, help provide nutrients to the skin, helps provide, I think, a little bit of oxygen, and then, of course, whatever serum you want to add to it. They are safe for all skin types. I usually will tell a lot of my patients that there's a lot of things that are great for all skin types. It usually will depend on who is the operator behind the device or the laser or the treatment. So you want to make sure that you're going to someone that has been trained, particularly, again, an esthetician or possibly a physician, depending on what that procedure is. And definitely have the consultation first. I think everyone would agree, getting the information, kind of explaining what your concerns are, and then talking with whoever's going to be doing your procedure to make sure it's the right one for you.
Okay,
but I'd love to hear some of the estheticians, like if any of the estheticians want to kind of throw in if they do it or if they have any experience with it, I would love to hear more about it.
Yeah, that'd be great. Does anyone who does hydrofacials want to weigh in?
Yeah, I mean, for dermal infusion, the thing that's really great about it is completely customized. So, you, the esthetician, are coming up with a plan for that skin and really infusing the skin with what it needs. So everything is completely tailored every time. If your focus is more anti-aging, we start to add more of those ingredients. It really can be a really customized, pretty gentle treatment for most skins, and it really can work on those conditions. But I definitely think that texture, pigmentation as well, maybe not as it's similar to microneedling, maybe not the same depth, definitely not the same depth, but it can work on some of those issues as well. So it is really customized and it helps you look very fresh, very glowy, very clean.
Awesome. Thank you, Allie and Dr. Davis. My next question is for Jasmine. How much does diet contribute to acne? Someone asked, and I know we've talked about this before because I love ice cream, but I probably shouldn't eat it. So would you like to weigh in on that?
Hi, everyone. I'm Jasmine. I'm so excited to be here. So with diet, absolutely. Dairy for me, I'm going to say for me was like the #1 factor for breakouts. It's going to trigger a response when it breaks down in your body and sometimes will contribute to that. Also greasy foods. And another thing, I know me and you talked about this too, Jasmine, was sometimes you can have a response to some certain types of foods, even if they're healthy for you, and you could just be having an allergic reaction. So sometimes even getting an allergy test will be really great, especially if you have like a consistent diet and you're consistently breaking out or having flare-ups. It's great to kind of go get an allergy test or just pay attention to different changes within your diet. And water. Drink a lot of water, please.
Yes. Awesome. Thank you. I'm sure for many people, like I love dairy, but it does not love me. So gotta cut it out. Awesome. Okay. So my next question is for Dr. Paul. So this one's about lasers and peels and retinoids and all that fun stuff. So somebody asked, how soon prior and for how long after should you stop retinoids if you're going to be getting peels or using lasers on your skin?
Hi, everyone. So nice to be here today. So that's a very good question. And to be honest, there is no right or wrong answer to it. What's important to understand is retinoids, yes, based on the way they work, they do increase skin, they can cause the skin to be a little bit more sensitive and can cause peeling. So the whole idea of holding off the retinoid is so that you can tolerate the procedure better. Some places, depending on what kind of procedure you're getting, if you're getting laser resurfacing or you're getting something milder like a chemical peel with a milder peel, you might hold the retinoids off just like a few days prior to the procedure. But like something, again, if you're doing something deeper, some people might say to hold it off for like a week or longer. Mm-hmm. In terms of resuming it after the procedure, again, it depends on, how your skin heals. Once your skin has healed to the point where you can start tolerating that retinoid, that's when you would want to start. But again, it's a very case-by-case analysis, depending on how your skin is healing.
Okay, awesome. Thank you. That's great. And this next question, it's kind of a two-parter. So I'm going to have Sylvia answer first, and then I'll ask Dr. Mitchell the second part. The first part is somebody writing in saying they have a few stubborn dark marks from acne on their face. And how do they get rid of those? So I know, Sylvia, that you really focus on acne and hyperpigmentation. Can you talk about some of the treatments that you recommend to clients who come in and see you? I think you're on mute.
Okay, hi guys, thanks for having me. So happy to be here. Definitely dark spots from acne is a major issue, but the first thing we have to do is stop the acne. We can't really control the dark spots until we figure out where the problem is coming from. That's something that a lot of clients don't understand all the time. They just want the spots gone. So we have to control the acne, figure out where it's coming from, whether it's diet, lifestyle, control that. Once we get the acne controlled, then we can go in and focus on the hyperpigmentation. And that can be via treatments, that can be via home care, usually a combination of the two. But we do have to address where the issue is coming from first before we can really treat the hyperpigmentation. Otherwise, we're just kind of going in a circle.
Okay, awesome. Thank you. And Dr. Mitchell, the second part of that question, somebody asked about having ingrown hair and having dark spots as a result of that. So can you talk about how you recommend clients deal with that?
Yeah, absolutely. We definitely, since we know that we're honing in on the ingrown hairs, we talk about safe ways to remove the hairs. And we typically don't recommend that we pluck, the hairs, that we pull at them, because that tends to be more traumatic to the follicle. And any trauma to the follicle is going to start an inflammatory process, which in skin of color naturally will heal with pigmentation. And so we talk about, the ways in which we're removing, which, for some of us, for men, it's going to be a single edge razor. I happen to have women that use razors on their face, and so I have to have that conversation with them. The waxing procedure, if you're going to have that done, having that done with a professional would definitely be the way to go. And in the practice of most dermatologists, we want to exclude a diagnosis of hirsutism, which is a condition that hair can grow in a male pattern distribution on women. And so it's where we tend to have hair maybe under the beard, under the neck, on the chin, the upper lip. So we're always, as dermatologists, working with estheticians, we're always trying to figure out if there's an underlying reason for the hair growth. And If so, then we can address that with medication as well.
Okay, awesome. Thank you. That's a really, really good answer. And this next question I want to ask, it's another two-parter, so I want to ask Dr. Rembia to weigh in first, but what are some ways to nurture and repair your skin after a summer of sun? And they emphasize direct and indirect, and I know we're all getting a lot of indirect sunlight right now, so can you talk about that?
Absolutely. First of all, nice to meet all of you guys. I'm so excited to be here. So I think every single person on this panel right now will agree with me that sunscreen, 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 the most important thing in really protecting our skin before the damage happens. And I want to say that this doesn't really apply just to the summer. This is all year round. We get UV damage just from driving our car every day to work, or walking past a window. So it's really important to make sure that we're wearing sunscreen daily. So if you aren't doing this, it's not too late. Start today. Make it a part of your daily lifestyle, at least SPF 30 or higher. Make sure it says broad spectrum. Wear sun protective clothing, wide brimmed hats, sunglasses. Remember to reapply your sunscreen, all that good stuff. As far as nurturing our skin and repairing it after sun exposure, I think it's great to incorporate an antioxidant into your daily skincare regimen. So vitamin C is a wonderful option. It can work to really fade dark spots that are caused by sun damage. It can brighten your skin, promote collagen production, things like that. Other options are alpha hydroxy acid, so glycolic acid, lactic acid. We can really use these products here to kind of exfoliate the damaged portions of the skin and help to renew the skin surface. Other things to kind of keep in mind, if you've already gotten a sunburn, what do you do now? So, at this point, you really want to shift your focus to more so like soothing your skin, decreasing the inflammation that the sunburn has caused. Stay really well hydrated, use cool compresses, using aloe vera based moisturizers are great to soothe the skin. Another thing to keep in mind is, your skin will start peeling at this point, and you shouldn't be, helping your skin do that. You shouldn't be peeling it yourself. That can really worsen the scarring and hyperpigmentation that can happen down the line. So just take a break from other irritating products that you might be using, your retinoid, your glycolic acid. Just focus on gentle skincare, gentle moisturizers, things like that.
Awesome, thank you. And Dr. Kaga, just a follow-up question on that someone had. Are there specific products that you use or that you recommend for sun protection or repair?
For sun protection, I prefer physical sunscreen. I feel like you get broader spectrum coverage, and also there have been some studies recently to suggest potential systemic absorption with chemical sunscreens. So I tend to go toward physical sunscreens for those reasons. I also prefer tinted sunscreens and sunscreens that contain iron oxides, especially now that we're indoors a lot more. We're still getting exposure to visible light. So those are, the reasons that I tend to go towards that type of sun protection. Some of the lines that I use, Elta MD, Tizo I like as well. I blend with Dermablend because they do have some studies published showing their results with iron oxides as well. And then I agree with Dr. Rambia about a lot of the kind of restorative treatments that she's mentioned. She talked about the acids. I mentioned retinoids earlier. I think that will also be important in kind of repairing some of the sun damage throughout the year, but especially at the end of summer, once we've been out in summer, all in the sun for this season. And then chemical peels, if you're looking for office-based procedures to sort of get a more dramatic impact. Because again, we are giving the patients a slow induced injury to stimulate the healing process and kind of get rid of the damaged superficial layers of the skin. And then depending on what their concerns are, if they have a lot of textural changes, you may even consider some energy-based resurfacing type of procedures in the office as well. So there are lots of options, but I think throughout this conference, we're probably going to emphasize, making a consultation so that you can really get a customized regimen that works specifically for your concerns.
Okay, awesome. Thank you both for those great answers. My next question is for Dr. Darji. Somebody wrote in and asked, when they're using topical antibiotics for their skin on their face, when should they stop using them? They said that they've heard 4 to 5 months sooner. Like, how long do you wait, I guess, to stop using?
Hi, I'm Dr. Darji or Kavita. I'm excited to be here with everyone today. I think this is such a wonderful conference. So to answer that question, it's actually, so what are you using your topical antibiotics for? So sometimes we use them for wound infections. We use them for bacteria buildup. When you get hurt, for example, you might be using it for chronic skin conditions like acne or rosacea as well. So what are you using your topical antibiotics for is kind of one thing to keep in mind. Oftentimes, if you're using it for healing after getting hurt, sometimes topical antibiotics are recommended, sometimes they're not. They do tend to cause a lot of allergic reactions as well, so you have to be careful with them. But usually it's a few days to a few weeks for those conditions. But if you're kind of looking at acne or rosacea, for example, we do tend to use topical antibiotics for longer periods of time, so several months. The important thing with topical antibiotics for chronic skin conditions is to make sure that you're not using it as monotherapy. So it's not the only thing in your regimen. So you're incorporating, for example, if you're treating for acne, a topical benzoyl peroxide or a topical retinoid as well. And the whole point of that is to prevent resistance. And so that's something to keep in mind. When you're looking at oral antibiotics, duration is a little bit more important at that point. And so, you know, that's something that you have to talk to your dermatologist about for your specific skin condition. But generally for acne, for example, the whole plan is to have kind of you taper down the oral antibiotics after a couple months to make sure that, you know, the inflammation is controlled at that point. But that would be my answer to that question.
Awesome. Thank you so much. Those are great answers. A lot of good stuff. And the next question I want to ask two people their opinions to weigh in. So Dr. Clay is back with us. So I want to ask, how can we combat corona mask breakouts or maskne? What are some of the things you recommend?
First of all, hi everybody. You definitely want to wash your mask. I think sometimes, you know, you might have that cloth mask that you leave in the car and it's your go-to thing, but make sure that you are rotating your masks or at least washing. If you only have one, wash your mask, just hand wash it at night and air dry it so that, you know, you're not reapplying that mask every day, pushing dirt and oil into your pores and it's just kind of hanging out there. The other thing is to make sure that you are cleansing twice a day and that if you're, you know, desperately needing to put makeup on, that you try to take it off as soon as possible. Because with the makeup and then the mask, you're still just pushing more things onto the skin and occluding and covering up the pores. And then you want to get into a little bit more skincare if you haven't been doing much. It's a good time to now, especially with the breakouts. You can start with something as simple as Dr. Kavita just mentioned, a topical benzoyl peroxide wash, which is great for getting bacteria and germs off of the skin. It helps to unplug some of the pores and minimizes breakouts. You can also use exfoliants in a chemical form, not scrubbing the face. And these exfoliants would be products that have lactic acid, glycolic acid, salicylic acid. So your alpha hydroxy acids and your beta hydroxy acids. Make sure you incorporate them slowly so that you don't exfoliate too much and get too irritated. And moisturizing is important. We don't really think about moisturizing when we think that our skin is breaking out because we're thinking that we're probably going to make it worse. But the masks are causing, you know, rubbing and friction and possibly irritation on the skin that could lead to inflammation. So you want to create a little bit of a barrier between your face, your skin, and that mask. So moisturizing is important. And if you've done, you know, a good trial of some things over the counter for a couple of a couple of months, and you're not improving, then go see a dermatologist. You might need a little prescription too.
Awesome. Okay, thank you so much. And I want to ask this next question of Dr. Davis first. So what are some of the products and treatments that you suggest to help with hyperpigmentation? I know you have like a great routine down pat.
Yeah, so I feel like that's a question we probably all get throughout the day, throughout the week with a lot of our patients and clients. So for hyperpigmentation, Dr. Hope Mitchell mentioned this when she first started addressing one of the other questions. You have to look at what's causing the hyperpigmentation first. You know, what is the primary process? Is there acne? Is it eczema? Is it an allergic reaction? You know, is it some other medical condition that you have? But whenever there's hyperpigmentation, that's usually a message to us that are looking at your skin that there is some sort of inflammatory process that is affecting your melanocytes, and your melanocytes are just sensitive, so they release their pigment that results in hyperpigmentation or post-inflammatory hyperpigmentation. So first you want to address what's causing it, because you want to treat that first, whether it's the acne, the rash, the allergic reaction, etc. Then, of course, I always talk about sunscreen as kind of the second level, because wherever that hyperpigmentation is, especially on the face, the sun is always going to be kind of delaying that hyperpigmentation from fading. I don't know if some of you have experienced it, but whenever you get a brown spot from a pimple, it can sometimes take months for it to fade away. And that's because the sun is still stimulating melanogenesis, which is melanin, which is pigment. So you want to make sure that you're protecting your skin from the sun. And that includes if it was a little breakout on your arm or something, patients want to know how can they get their, normal skin tone back, and it's going to be definitely protecting it. Then kind of my third step will be kind of looking at, is there an agent that we can use to help address the hyperpigmentation itself? So whether that's a lightening agent, possibly something that has vitamin C in it, something that may have a little bit of kojic acid in it. I do sometimes still recommend some products or possibly even prescription strength hydroquinone, but that's very specific cases. That's not necessarily my go-to for correcting pigment, because hydroquinone, or if you don't know, that's a bleaching cream that's prescription strength. It can definitely sometimes have negative side effects if you're not using it under the correct instructions, if you're using it too long, or if you're using something and you don't know the percent of hydroquinone that's in there. And even though it's prescription strength, it is in a lot of products that patients may sometimes find either at beauty supply stores, or they may get from family members. They will get it from Amazon. They will get it from out of the country. So you have to be very careful. But there are some great lightening corrective agents that are safe, but it just kind of depends on the situation. And then probably my fourth and fifth kind of go-tos and my ladder of what I think of would be possibly chemical peels, depending on where it is on the body and if we've addressed the primary process. And then lasers are a great way to also help correct hyperpigmentation in many different skin types. It's just going to depend on, again, the location, what's causing it, and if we have it under control, then there's a great number of options that are safe.
Awesome. Thank you. Those are a lot of really good options for people to look into. And Allie, I'd love if you could weigh in as well, just what you tend to go through with clients when they come to you with hyperpigmentation, some of the options that you present to them when they visit you.
Yeah, so the first thing I would do is recommend SPF. Of course, we can't stop what we can't prevent. So SPF is first. I also really recommend antioxidants. And I say antioxidants as opposed to specifically vitamin C, because there are so many more antioxidants than just vitamin C. And vitamin C is great, but if you have acne, sometimes if you're using vitamin C in high percentages, it can irritate that acne and then create more. So really look for an all-encompassing antioxidant that has kind of a broader spectrum. There are a lot of serums out there that combine too. There's vitamin C and E, vitamin A, C, and E. You're really getting that full spectrum skin health. I think of it as breakfast for your face in the morning. We all need it to power through the day. So antioxidants, I do love retinoids at night. Some people really find that irritating, but if a retinol is irritating, maybe start at a lower formulation, whether that be a retinol palmitate or maybe an encapsulated version of the vitamin A. Sometimes if you start too quickly, you use it too fast, you will get that dry skin irritation. That's pretty normal. Over time, that will fade. But if you are a little bit nervous, start lower, go slower and kind of move up that way. And I also really do like AHAs as a way to kind of get some of that exfoliating in there. Using lactic acid, again, it's going to help brighten, glycolic. Salicylic is as good as well. I know in higher percentages we want to be wary, but if you're going to Sephora, you're not going to get more than a 2% salicylic acid, so you're going to be fine. But really just working on eliminating the acne, that's the first thing. And then slowly just kind of working on the integrity of the skin in itself and skin health, because we can't kind of fix if your skin is super stripped and dehydrated and your skin barrier is damaged. I think sometimes with pigmentation, we want to like strip, but remember, we also need to nourish and hydrate and really feed the skin a little love sometimes too. So sometimes throwing all the acids at it isn't always the answer.
Awesome, thank you. And my next question is for Dr. Paul. So this person wrote in and said that they have sunken dark under eye circles that many people do because of their melanin, and they want to know what's the best way to take care of them or help if you can prevent them. What can we do?
So that's one of my favorite questions, dark circles, right? Because it's a huge topic and it's very common, and personally I have them too. So what's very important is what are dark circles, right? So the skin right underneath our eye, it's very thin to begin with. And that's why the underlying blood vessels and the veins, when they get very prominent, they appear as this purple hue and this dark circle. Also, as we get older, the skin continues to get thinner. And also there is a fat pad over there that kind of goes down, thins out, and then the collagen production goes down. So given that structure, understanding that structure, it's also very important to understand what's causing the dark circle. Sometimes it can be just lack of sleep, and try to get your good 7 to 8 hours of sleep, which is much easier to say than actually get it done. But then there's also environmental factors. Smoking can make it worse, sun exposure. So going back to sunscreen, if there's one takeaway that you can take from this conference, I think all the dermatologists and estheticians would tell you, wear your sunscreen every day, no matter what's your skin color, no matter what you're using it for, use it. Just like breakfast, go wear your sunscreen. So sunscreens also do help with dark circles. And then, things like if you have eczema, if you have allergic reaction, and if you're continuously rubbing your eyes, that can make dark circles worse. So again, try to gently touch that area, but not rub your eyes as much. And then, the most important thing comes down to is genetics and hereditary. So it runs in the family, especially for fellow South Asians and Indians. I know a lot of people have it because, their parents have it. And then it gets very tricky in terms of treatment. There are creams, and we'll get into the creams, but something that works much more better than that is sometimes doing fillers in that area to, again, increase that volume, or even laser treatment. But then going back to the eye cream, right? Should I buy that $500 eye cream or not? There is no magical eye cream out there that will wipe off your dark circles. Creams are important in the sense, it's again very important to keep that area hydrated. So any cream with even hyaluronic acid in it, niacinamide, which helps with inflammation of that area, is very, very important. And then sometimes you can have components such as hydroquinone or vitamin C, which helps with the pigmentation. They help as well. But, it's very important to have realistic expectation. There is no cream out there that's going to completely wipe off your dark circle. At the end of the day, sometimes you might have to use concealers, and that's okay. In the morning when you're taking care of your skin, at the end of the, when you're putting on your makeup, put a little bit of concealer. But then at night, once you take off your makeup, the best thing you can do is put either an eye cream with the components that I talked about, or even just sometimes what I do is if I have a nice greasy moisturizer, I just very gently dab on a lot of moisturizer before I go to bed, just so that the skin stays hydrated.
Awesome, thank you. Those are a lot of good things for people to look into and try if they're having this issue. My next question is for Dr. Mitchell. So someone wrote in and said, how can we address cystic acne due to hormones and things of that nature? Is there anything we can do in preparation to avoid this?
So yeah, definitely seeing the dermatologist with cystic acne is definitely a place to be. And often in combination with the esthetician would be fine. Now with cystic acne, what we tend to do is doing the evaluation for hormone imbalance. And the evaluation starts with getting a really good history, and sometimes doing blood work. And what we have found is that there is a condition that we commonly see as dermatologists called PCOS, or polycystic ovarian syndrome. And we often, as dermatologists, we can diagnose that just based on history. We don't typically need to do blood work to make the diagnosis, but there may be a case in which we do it because PCOS can often be associated with high glucose levels or high blood sugars. And the treatment plan that we come up with may include decreasing those levels or prescribing a medicine called metformin, which we often will collaborate with the endocrinologist if that medication is needed. And so we can prescribe treatments like birth control pills that can help with the acne. And then there's another medication called spironolactone. And spironolactone does a good job because it's an anti-androgen medication. And, you know, often what we find is if we can balance out the hormones, if we can control any underlying factors, then we're able to do a really nice job helping with the acne. So just to back up, PCOS is a condition in which we can see acne, we can see hirsutism, which is hair growth in a male pattern distribution. That means hair growth it's growing normally where men would grow hair. And patients often have irregular periods. And so oftentimes patients will come in and tell me they think they have the condition because they are able to find that information online. And once we start treatment, once we educate and start treatment, we really can make a big difference in the cystic acne, in the hirsutism, in all the components, and improve the quality of life of these patients.
Awesome. Thank you so much, Dr. Mitchell. The next question, I want two people to weigh in. It's a two-parter. The first part is for Dr. Clay. So what's the best way to keep the skin moisturized throughout the day?
Two things, actually. So number one, if you tend to be pretty dry, you probably want to add a hydrator first. And a hydrator is something that's going to contain hyaluronic acid. Hyaluronic acid works like a water magnet. So the water that's on your skin, it allows it to absorb and sequester more of it to keep it there. It can absorb 1,000 times its weight in water. So it's a really, really powerful hydrator. Typically with your hyaluronic acid, it mostly comes in serums. And so I would put that on first after cleansing and drying the skin. And then you could do any products that you need that are treatment based. And next to an actual moisturizer on top of that, if you need extra moisture. If you're extremely dry, you want to add a moisturizer on top, and look for ingredients like ceramides that are really going to help protect and repair the skin barrier so that you're not losing extra moisture as well. You want to do that twice a day.
Okay, awesome. Morning and night. Great, great, awesome. Thank you, Dr. Clay. And the next question it's related. I want to ask Jasmine, I know you have your hydrating rose water. So can you talk about how that and some other things might be incorporated in a moisture routine for people?
Yes, I'm going to bounce off of what Dr. Clay said as well. You want to make sure you're having the hydrating products that's going to help with improving your barrier, your skin barrier as well, and protecting it. As far as the rose water, how I incorporate it into my routine is between each step in the regimen, especially if you have dry skin or acneic skin. Hydrated skin is always going to be healthy. So if you're using that toner or hydrating rose water in between each step in your routine, so you're cleansing and then you're spraying the rose water, you're doing your serum and then you're spraying the rose water, and then you're doing a moisturizer and also spraying the rose water, you're prepping your skin for the next step in your routine, and then your products will be more effective when you're using them.
Awesome.
And
thanks.
Sunscreen. You still need to make sure you're still protecting your skin as well. So, yeah.
Absolutely. Yeah. If people leave with nothing else, I think people know now. If they didn't know before, you have to wear sunscreen. So thank you. Okay. My next question, I want Kimberly and Sylvia to both answer this question. Somebody wrote in and said that they're starting aesthetic school soon and they want to be able to focus on Black skincare concerns. What should they pay attention to the most, and what issues do we struggle with the most? So I want both of your perspectives. So Kimberly, can you weigh in first?
tough because technically there isn't a school that's all related to multicultural skin. So there's a few things that you could do when you're interviewing the school. You could ask the ratio of the students that attend. You can get very detailed and ask the administrator about the treatments that are performed. Are these treatments ideally for all skin types? Do they offer a section where they focus on multicultural skin? Because it's tough. I can tell you that you're probably going to just get the basics in school, and then that's where advanced training will come in once you're licensed, where you're able to reach out into other communities and sometimes brands that really focus on multicultural skin for you to take advanced training. But the biggest thing for me is making sure that the school is accredited first and foremost, and ask for references from students that attended, ask for the pass and fail rate of that school, you know, their percentage of students that's passed the state board. But it just depends. I think once you walk into that school and you're able to speak directly to the administrator and ask those important questions, wanting to know the type of products that are used in the training kits, and you know, hey, I want to be trained on all skin types, you know, and you have to be very upfront with that. That's my take on it. But the truth is, you're going to do more advanced training once you're licensed to really get into your niche and be able to handle all skin types, especially multicultural skin. That's my take.
Awesome. Thank you, Kimberly. And Sylvia, can you weigh in on your perspective on what that experience will be like for her?
Yes, I agree 100% with Kimberly. I think it's also going to depend on the demographic, where you're located, what state you're in, the education that you're going to get. I would definitely ask to shadow, be in that classroom and see what's going on, see how confident those educators are. And it's definitely going to be, again, like Kimberly said, advanced education. I know that when I went to aesthetic school, it was strictly the basics. You're learning a normal facial. You're not getting it. We didn't even get into microderm, chemical peels, any of that. I think now it's a lot more advanced, but again, it's going to be your education outside of your aesthetic school. But I would definitely do my research. That's very important. And I think when it comes to deciding what you want to focus on with African American skin, I think one of the big things is that we need a routine. I think so often we grow up in households where we don't see our mothers doing a skincare routine. So it can be unknown, you know, it's just something you don't see right now. I think more and more we're seeing it, but if you didn't grow up seeing your mom cleanse her face and mask and put serums on, you just don't expect it. And so when you go to school, you don't know what to expect. So I think it's all brand new for a lot of the esthetician students, and they want to focus on giving African Americans a routine. Sunscreen. It's a myth that we don't need sunscreen, that we naturally have melanin, so we don't need sunscreen. I see it day in and day out. And educating them that, yes, this is something we need. Yes, we need a skincare routine. Even if you have pretty nice skin, a lot of people think, oh, I don't need a routine, but teaching them the reason why. So educating yourself so you can educate your customers.
Awesome. Thank you, Sylvia and Kimberly. Those were really good, really great perspectives. And I think also just emphasizing that a lot of the learning may be done outside of the traditional school, because, you know, you may not see yourself reflected all the time. So I think that's really important. So thank you. My next question is for Dr. Kaga. So somebody wrote in and asked, how do we effectively reapply sunscreen during the day with a face full of makeup?
Yes, this is a great question. Hopefully now that we're in the middle of a global pandemic, we're not wearing a full face of makeup as much, unless we're on Zoom. But yeah, especially, you know, wear your mask lays, because we're occluding the skin. And so like mentioned previously, you want to prevent acne in those areas. But, for the normal time outside of the pandemic, when we're not wearing masks and we are wearing makeup more often, I think the first step before applying the makeup, be sure to apply your sunscreen. So your normal routine skincare that contains your SPF of at least 30, at least 15 minutes before leaving the house or before sun exposure is going to be important. I know a lot of makeup products advertise having SPF in them, but they're often not high enough in concentration to replace the SPF in your skincare products. So that's going to be number one. Number two, we recommend upon sun exposure, you want to reapply your sunscreen every 2 hours, but you don't want to mess up your beautiful makeup. So they do, there are some products that have a powder formulation that you can apply over your makeup to keep your makeup in place. I know Color Science Unforgettable makes one, and Isden also makes one. So those are good options for people that don't want to disrupt the beautiful artwork that they've done on their face throughout the day.
Awesome, thank you. My next question is for Dr. Mitchell. So you touched on glycolic acid before, but someone wanted to know, they said it can be really strong on darker skin. So what strength would you recommend for someone with darker skin? And does it actually differ based on what they've heard?
I would love to have an esthetician help me with this as well, but I think glycolic acid works really well on skin of color. In my practice, it's actually one of our go-to acids, along with lactic acid and mandelic acid. Mandelic acid actually, I think, is fantastic for pigmentation. And I personally think that starting at 30% glycolic acid, even using 50%, has been very successful in my practice when I treat, my patients with skin of color. And I actually love, the step up technique. I actually love mixing acids, blending acids. I've never been one to believe that just because we start here, this is where we have to stay, appointment after appointment. And so I think it's really important that you, when you're seeking these treatments, that you work with someone who is willing to customize your treatments, according to your needs. And that's what makes the industry so fantastic, is that we have so many options and that we're able to, for lack of a better word, mix and match and change it up. So I actually am a proponent for glycolic acid in skin of color. I think it works very, very well.
Awesome, thank you. And to Dr. Mitchell's point, do any of the estheticians want to weigh in on their perspective on glycolic acid?
Yeah, I think it does. It depends case by case. What works on me glycolic percentage wise may not work on you. And it's really important to have a provider who is looking at you and all of your history, all the products you're using, and kind of taking a larger view of how your skin is responding, what medications you're on. Also, your ethnic background makes a difference. Some skins respond differently. Some skins who maybe appear lighter, but if you are from Asia, like you're going to pigment dark, you really have to take all of those things into consideration, and really making sure somebody who is doing any kind of peel on you really knows how to use it and how to use it for your skin. So there really has to be trust there. But glycolic is great. You just really want to make sure that whoever's doing it knows what they're doing with you.
Awesome, thank you. This one I want to ask two people to weigh in, because I'm sure answers may differ a little bit. So first I want to ask Dr. Darji, someone asked, how should their daytime and nighttime skincare routines differ? So can you tell us generally how those might differ?
All right, so two-part question, I guess. We'll start with daytime. So important things for daytime, you always want to clean your skin. So that's twice a day. I recommend cleaning in the morning and also cleaning at night. Double cleansing is actually a great thing to do. So using like a water-based cleanser, I love CeraVe hydrating cleanser. Cetaphil is great too. So that's one part. And then also, I like to use micellar water to clean my skin as well with a cotton ball afterwards. It helps to remove residual makeup. So cleaning morning and night is beneficial. At night, the double cleansing is especially important because after a full, like if you wear makeup throughout the day, then it helps to take it off. In the morning, I like to, we talked about antioxidants. I like to apply a vitamin C serum in the morning. I love SkinCeuticals. CeraVe also has a vitamin C serum that I like. Revision Skincare has a good one as well. There's several out there. They differ, by various different ingredients or like the way they apply onto your skin. So you just have to find something that works for you. And then last but not least, I don't think, I think this has been hammered, but sunscreen is super important for your daytime routine. So broad spectrum, which covers both UVA and UVB rays, we're looking at SPF 30 or more every day. Reapplying throughout the day is also a great thing to do that we recommend. So those are important things to do during the daytime, and then also a moisturizer. So you want to have a gentle moisturizer, something, if you are acne prone, something that's oil-free, non-comedogenic is what we recommend. And then at nighttime, what we like to do is also clean our skin. I recommend using a topical retinoid, which is a prescription strength vitamin A derivative, or if you don't have that, then you can also find, it would be a less strong version, but a retinol over the counter. So applying that would help to increase cell turnover and also increase collagen production. So that's an important element in your nighttime routine. And then hydration, so something with hyaluronic acid. Hyaluronic acid, like Dr. Clay mentioned, it's a molecule found in your skin barrier that helps to retain moisture. And so using that at night is something that I like to do. I love the Neutrogena Hydro Boost Gel Cream hyaluronic acid moisturizer. I know there's La Roche-Posay has a nice one. There's different companies, but that's something that I like to do. And then you can't forget your lips. So I do like to apply Vaseline at night to hydrate my lips. So that's
awesome. Thank you. That's really great. And so I hope everyone's taking notes because that's like super specific. And Dr. Paul, can you weigh in if you have like a daytime, nighttime skincare routine, what that looks like for you maybe, so people have an example?
Yeah, for sure. So another thing I want you guys to take away from the conference is sometimes less is better than doing a crazy 10-step process. Because, we have patients who will be like, oh, should I do all these long list of things? Well, first of all, if you have the time, then maybe great. Second of all, if you can tolerate the products, okay, maybe great. But then a lot of times what we see is when patients cannot tolerate all these crazy 10-step process on their skin, that's when they come to see us as dermatologists because of some crazy, contact dermatitis on their face and whatnot. So that's why, one key thing that I like to emphasize is sometimes less is way better. So for the morning, the three most important things according to me, and again, I kind of along the lines as Dr. Dorji said, cleanse your face, B is to moisturize, and C is sunscreen, sunscreen, sunscreen. And for the evening or at nighttime, very, very important to remove the makeup. Because if you're sleeping with that makeup on, again, your pores are going to be clogged. If you're prone to acne, it's only going to make it worse. And then, I have a lot of patients that ask me about the makeup removing wipes. And I have kind of love-hate relationship with them because sometimes when I'm personally very lazy or like, had a long day and I'm tired, they're very convenient to remove your makeup. But then on the other hand, you have to be careful because all the makeup removing wipes are doing, they're kind of like smearing off the makeup. They can still clog your pores and they have preservatives in it that can also irritate your skin. So my recommendation would be, even if you're using one of the makeup removing wipes, try to still get up to the sink and use a mild cleanser to gently wash your face off. And then again, after cleansing, moisturize one more time. Even if you have acne skin, this is a very important concept. Even if you have acne prone skin, you have to moisturize your face. Because if your face is dry, then it's going to paradoxically produce more oil and clog up those pores and cause acne. And then the third thing is retinoids, like we've all been talking about. And this conference is great and there is a lot of information coming at you. But another thing I would highlight is there is a lot of information, educational information on skin related conditions on all the Instagram pages of all the dermatologists out here and the aestheticians. So take a step back and go take a look there. Recently, I had done a post kind of just telling the difference between the retinol and retinoid. Long story short, retinoids are much stronger than retinol, but a lot of time people will give up on using them because they can dry out your skin and cause flaking of the skin. And it's very important to use them correctly. You know, use it every third night the first couple weeks, then every other night the next couple weeks. And slowly, once your skin get used to them, they are by far probably one of the most effective anti-aging product, aside from sunscreen, that's very good for your skin.
Awesome. Thank you, Dr. Paul. I see a lot of head nods, so I think everyone's in agreement. Thank you so much. My next question is for Dr. Davis. The first part is, so what topical ingredients are best for acne and hyperpigmentation? I know you mentioned hydroquinone before, but are there others that you recommend?
Yes, so best topicals for acne and hyperpigmentation. I mean, I think Dr. Paul hit the nail on the head. I mean, and we've all been talking about it, but retinoids are great. And again, there are some different retinoids, there's different strengths, there's different types. But what I like about a retinoid and how I explain it to patients is that it's going to first, address the acne they have. It's going to prevent them from getting pimples in the future. It's also going to help with hyperpigmentation because Dr. Clay mentioned it as well. It's a chemical exfoliant. So I think a lot of us are, not fans of the gritty exfoliants, tough, gritty cleansers or things like that. I mean, a retinoid is a great way to slowly even out your skin tone. And it also helps stimulate collagen. So it's a little bit of it helps with fine lines and wrinkles. So it's a little bit of a, one, home run kind of hit when we're trying to look at acne and hyperpigmentation. But there are some other great topicals that do have lightening and that do have some skin tone or lightening agents in them. A couple would include SkinCeuticals has a product called Discoloration Defense. It's a serum, but it has kojic acid, it has niacinamide, and I think it has a little bit of tranexamic acid in it as well. And so those are some great products that can help with hyperpigmentation. Leite 2.0 is by Skin Medica. Another great product that has some niacinamide and kojic acid. Skin Better Science is another company. They have a product that's called Tone. So some of these are a little bit of competitors to each other, but Skin Better Science is a great company that makes great products that I think are very non-irritating to the skin. So it's a product line that I recommend for patients, but that also is going to have some ingredients. So I do like kojic acid. I do like niacinamide. Dr. Hope Mitchell mentioned mandelic acid, and sometimes that's sometimes a forgotten component, but mandelic acid is a great product that can also help with hyperpigmentation. And so again, some of these products we can, prescribe as dermatologists. We can recommend products. Again, your estheticians can recommend it for your facials or your hydrofacials or whatever products that they're recommending. So again, it's just going and getting the proper information for your skin type that's going to be the most beneficial so that you're not trying everything in the market and spending all of your money on something that may not be the best for your skin.
Awesome. Thank you, Dr. Davis. And Dr. Rambia, can you talk about maybe some of the products that you might use or maybe suggest to people who have acne?
Yes, great question. I think the first thing that's really important to consider is that there are many different types of acne. You really do need to be evaluated in the office to really come up with a regimen with your dermatologist that addresses the cause of the acne and the type of acne that you have. But moving towards like what are the best topical products for acne, in the morning, I love to recommend benzoyl peroxide face washes. So benzoyl peroxide has antibacterial properties that kind of combat the bacteria that cause acne. It can decrease inflammation, can prevent acne from forming. You'll find benzoyl peroxide typically in concentrations of like 2 to 10% in over-the-counter face washes and spot treatments. But it's important to remember that just because it's a higher percentage doesn't mean it's more effective or better for you. So oftentimes I find that above 5%, you're not really getting more efficacy in the product, but you are getting more irritation. Benzoyl peroxide can be really drying, really irritating. So it's important for patients to start slowly and gradually kind of build up. I really like the Panoxyl acne wash. Neutrogena has a great one called Clear Pore, which has benzoyl peroxide in a 3.5% concentration. And then, after that, like everyone has been emphasizing, it's really important to moisturize with a non-comedogenic moisturizer. And then SPF, do not forget the sunscreen. In the evening, I like to recommend just a gentle cleanser. Dr. Darji mentioned the CeraVe hydrating cleanser, which I love. And then, pat your face, let it dry. Don't scrub at it. Scrubbing at acne will really just worsen the inflammation and make it worse. And then a topical retinoid. The reason I say to apply topical retinoid at night and the benzoyl peroxide in the morning is that those two products have been shown in studies to inactivate each other. So that's why I recommend the retinoid at night. Also, different types of retinoids can be inactivated by the sun. So in general, it's just best to apply that at night.
Awesome, thank you. And I loved how you emphasized, and I saw everyone nodding heads again, not to rub and scrub super hard, because people do that and wonder why their acne won't go away. So I think that's really good perspective. My next question, I have two parts of it again. People have a lot of two-parters here. So Dr. Clay first, people want to know, is it safe to do several types of treatments and products at once to combat hyperpigmentation? And I think Dr. Rambia alluded to that a little bit, but I'd love to hear your perspective.
It is. It can be helpful, but as with everything, want to do it in moderation. And it may be important, if you're doing products over the counter and doing kind of like a do-it-yourself thing at home, that you start one product at a time, because you may have irritation or an allergy to something. And sometimes products may not play well together. And there's also a rash that you can get if you use a lot of new products all at once called perioral dermatitis. So, and it kind of looks like acne a little bit. So you may think your products are causing acne when you're actually just, your skin's just a little upset that you did too much too soon. And then another thing is that if you start 5 medications or start 5 treatments on your own at home, you could be allergic to one and you don't know which one you're allergic to now because you started everything all at once. So I think if you're doing it at home, start slowly, and especially with acids and acidic type products. And then secondarily, of course, it's always better to partner with an esthetician and a dermatologist to discuss which treatments can be used safely at the same time. So, if you're over exfoliating with a chemical and a chemical cleanser, and then you're applying a serum or a lotion that also is a chemical exfoliant, you could actually cause enough irritation to make the hyperpigmentation worse. So that's, the worst case scenario. So it's safe, do it in moderation. Start one product at a time, typically 1 per week, and get help if you need it.
Awesome. Thank you, Dr. Clay. And Kimberly, can you weigh in on some of, given that it is or can be safe to do multiple treatments at once, can you talk about some of the treatments you do in your practice to treat acne hyperpigmentation, like when someone comes to see you?
So to piggyback off of what Dr. Clay just stated, you definitely want to be under the supervision of an esthetician or dermatologist, because ideally you want to have a regimen coming in the office, what treatments that we're going to do, but most importantly, your home care, the prepping of the skin, how often we introduce a new product, into your regimen, giving you that time frame to see if your skin is reactive to a new product that we may have introduced to you. So it's the biggest thing for me is patience. And it's not a one treatment fits all. So it's a case by case basis, but I definitely would say that you can be on a treatment and use multiple products, but it's going to be done in stages. It's not going to be done all at once. Patience will be, the biggest thing, in consistency and making sure that we're both on the same page and communicating that we're following the steps that has been instructed for the client to use. But patience is everything, and following instructions and being consistent. But Again, not trying to use everything all at once, because you're right. If your skin has an explosion, you have no way of knowing. And if you want to try something different, because, hyperpigmentation and acne, it's emotional. You want to get rid of it so fast, and you're emotionally distraught about it, and you see something online and you think that, oh, it's okay, let me get this because the results that they show said it took 2 weeks or 3 weeks. No, just deal with the professionals, take your time and work on it together. It's a journey to get through with trying to correct the skin.
Awesome.
No.
So just no. So yeah, a lot of patience and consulting professionals, and don't do too much, as Dr. Clay said as well. Okay, awesome. And next question is for Sylvia. So someone wrote in and asked, how can I improve skin brightness? So maybe you can talk generally, and then maybe what you do with clients in your practice.
Sure. So skin brightening is something we see a lot. People have sometimes darker areas around the mouth we'll see, or in the forehead, especially if they were an athlete or were never aware of sunscreen. So some of the ingredients that we use here are kojic acid. Mandelic acid is one of my favorites to actually use in combination with vitamin C. I love the two together. And then combining them in-house with treatments, brightening treatments. And that brightening treatment could be chemical peels, it could be a brightening mask that we custom blend. And each time that client comes in, we're gonna cater to exactly what where their skin is at that moment in time. So again, I think Kimberly mentioned this too, it's never gonna be the exact same treatment. It's gonna vary based on, let's see, were you consistent the last 3 weeks when you were at home doing your skincare routine since I've seen you, or did you go to bed and not do your nighttime routine because I don't know what you were doing in COVID, but you just fell asleep. So it's all going to depend on consistency is key. Brightness is something that takes some time. It's definitely not an overnight thing. I mean, sometimes 3 to 6 months, up to a year. We're not using lasers and things like that to speed up the process. So the brightening process can take some time. And then the biggest thing, as we know, as we've said over and over again, is sunscreen. And yes, you wear your sunscreen even when you're not leaving the house, even though we're all working from home, except for us estheticians and dermatologists. It's a must. It's a must to keep that skin bright. And then making sure we're doing some exfoliation. So that exfoliation could be in the form of chemical peels. It can be in the form of your serums, which are exfoliating. I think a lot of people don't realize that your serums are exfoliating as well, depending on the active that's in them, whether that's mandelic, kojic, lactic. So it varies.
Awesome. Thank you, Sylvia. The next question is for Dr. Kaga. So we had someone write in and say they have brown skin and a darker birthmark on their nose. She said she's covered it her entire life and it's caused a lot of insecurity. She tried to remove it when she was younger, but was told it wouldn't work. And she wants to know if now in 2020, are there any solutions that you know of?
Yes. So I would recommend a consultation because I think the first step in figuring out what's the best treatment is the diagnosis. So we need to know exactly what it is. There's so many different brown spots and dark patches that could be on the face. There's moles and, DPNs. There's so many different things, and we have different ways of handling each of them. I know I've been asked this question before, and someone mentioned having a cafe au lait macule. That I would recommend scheduling a consultation for someone who's well versed with lasers or a dermatology practice that is very comfortable with that, and also very comfortable with treating skin of color, because anytime we're treating a pigmented lesion, we have to be very careful to not disturb the pigment of the skin that we want to keep in place. But there have been reports of successful treatment for that type of thing. I agree there's no guarantee, and you may require several treatments because, again, we want to be very careful to not cause any adverse side effects or worsen what's already there. But I wouldn't lose hope. I would just kind of schedule a consultation and get your questions answered. And, you know, you can work with your dermatologist and your esthetician, you know, and if the dermatologist isn't comfortable doing that type of procedure, I'm sure they'd be happy to make a referral for you and direct you in the right place. If you're in Boston, we'd love to see you at Mass General. But yeah, I mean, I think, again, it just, so many times we get questions, like even in the DMs, and people are asking, oh, what do I do for my dark spots? And then you look at it and it's actually a mole, or it's a, you know, a DPN, as I mentioned. So the diagnosis is going to be key, and then we can go from there and kind of discuss the different treatment options. So stay hopeful.
Awesome. Thank you, Dr. Kaga. Next one I want to ask is of Dr. Clay first. So they want to know what should be their skincare routine for dry and sensitive skin. So maybe just generally ingredients or product types that you would recommend for dry and sensitive skin.
So I would start off with your cleanser, of course. You probably are going to want to use more creamy or hydrating type cleansers. Sometimes the cleansers that are really foamy and bubbly, you know, we like to see that, and it makes us feel like our skin is clean, but sometimes that can take away a lot of your natural moisturizing factors that are in the skin. And so we want to obviously protect and leave as many of our natural oils on the skin as possible. So something as simple as a Cetaphil or a CeraVe hydrating cleanser. I like Neutrogena. They have the cleansing lotion. So it's creamy like a lotion, but it's a cleanser. There are several others that we could talk about all day, but we won't. And then next, obviously, and I would stay away from fragrance products too if you tend to be sensitive and dry. I think there's a little confusion between fragrance-free and unscented. And so products that are unscented actually have a scent in it that makes it unscented, which is confusing. So your buzzwords that you always want to look for is fragrance-free, because sometimes if you're sensitive, fragrances can actually be very irritating and can cause some itching and irritation. And the next item that you probably want to add is a hydrator, as we discussed earlier. So some form of product that is either a gel cream or a serum that contains hyaluronic acid. And then top that with a moisturizer. And for your moisturizer, I know we've been talking a lot about the face, but don't forget about your body as well. So your body care in the shower, you want to use a gentle body wash or a gentle bar cleanser, not a soap that'll strip the oils away. And so also replenishing that moisture on your body when you get out of the shower is just as important as it is on your face. So making sure that when you get out of the shower, you know, you pat your face and your body dry, and that you immediately apply your hydrator to your face and then your moisturizer to your face, as well as your body. And, you know, great products, you know, we like things that are natural, but you can kind of make a little incorporation and find a nice moisturizer that may have shea butter or that may have coconut oil, but you definitely want a creamier moisturizer if your skin tends to be more on the dry side.
Awesome. Thank you, Dr. Clay. And Jasmine, can you talk about what is in your recommendation for dry and sensitive skin routines for clients that you see?
I'm going to bounce off of Dr. Clay again. Her answer was amazing. But another thing that I would recommend too is oil cleansing. I typically oil cleanse as my first cleanse, especially it kind of dissolves the sebum. And when you're dry, what it does, it brings the nourishment back. You're lacking the oil that you need when your skin is dry. And of course, hydrating products, that is going to be key. You still want to apply SPF, creamy cleansers like Dr. Clay mentioned. And also your serums. And I do like that she mentioned, you know, incorporating your body, because a lot of people, when they put the serums on, they kind of stop at their, you know, like your chin area, but you're supposed to take it like all the way down, almost to like your boobs. Because all of this is incorporated into your face. Like your face just doesn't stop here. It kind of goes all the way down. So just making sure you're nourishing your body kind of from top to boobs, and also like your body care as well.
Awesome. Thank you, Jasmine. Next question is for Dr. Paul, and we've touched on this a bit, but I wanted to zero in on it. Somebody said that they've had facial hair growth problems, especially on their chin, since they were a teenager, and didn't understand it until they learned about hirsutism. So would you be able to speak more about that first? Maybe you can explain a little deeper what it is for people who don't know, and then what options there are for helping it.
Yeah, so I think we talked about this, but first and foremost, it's very important to get an evaluation done to see either by a dermatologist, to see again if it's because of an underlying hormonal problem. So PCOS, polycystic ovarian syndrome, is a hormonal problem where you can get this facial growth in a male pattern, especially on the chin, which is a lot of times what patients come in with. And in that case, it's medical treatment, medicines that you have to take through the mouth. Then aside from that, there can be other hormonal issues too, and that needs to be treated medically. In terms of other ways for hair removal, there are some methods that are safe even for someone with darker skin. So there are some lasers that are very safe and effective. But again, you really want to go to the right provider who does it in the right way. Because if you get a burn from the laser, if it's not done the right way, then you can get hyperpigmentation and a whole bunch of other problems that you want to avoid. There is electrolysis, which is technically it's FDA approved and it's supposed to be permanent. So what you do is, it targets each individual hair follicle and burns them off. And then even though sometimes you might need multiple sessions, but it's considered to be more of a permanent solution compared to laser, where it slows down the hair growth, but you might still continue to have hair growth. Other ways, of course, there is waxing or threading, and you can do those too, but you have to be careful. First of all, you have to keep up with them every few weeks or so. And second of all, sometimes it can also irritate the skin and you have to be careful. There is an FDA approved cream called eflornithine, which is approved in the United States for hair removal. Typically, you use it for 2 times per day for 4 to 8 weeks. Not a night and day difference in my opinion, but it does help to some extent. One problem is that typically it's not covered by insurance and it's a very expensive cream. But if you want to try it, it's much safer in a way because it's just a cream. But that's one way to address it as well.
Thank you, Dr. Paul. Our next question is for Dr. Mitchell. This person said, I'm in my late 50s and still have acne breakouts. My skin is sensitive and easily irritated. What is the best type of moisturizer to use for my sensitive combination skin?
That's kind of, that's a challenge because we would have to do an evaluation, but the short answer would be, and I think we've kind of gone into this, to avoid products that have alcohol, dyes, fragrance, and even some acids, because as we alluded to, you don't want to use the wrong acid or overuse that acid. I think of recommending products that may have ceramides, hyaluronic acid in them, colloidal oatmeal, aloe. Those are kind of buzzwords for hydration. And some of the products that I recommend, because it's easier for our audience to find over-the-counter products. But when you come into my office, trust and believe, I'm going to be recommending more medical grade products, but not to say that over the counter can't work, but sometimes we need more advanced treatment. But CeraVe has really good products. I would also look for hyaluronic acid and niacinamide in the CeraVe products. And so I think as a consumer, what I try to educate my patients to do is to read the labels, turn it around and look at what you're buying. Don't just buy something that says sensitive skin or, buy something that says anti-aging. Be accountable for what you're buying. And so flip that, product around, look at what's in it and look for these ingredients. Glycerin is hydrating. Niacinamide can help with acne. It can help with inflammation. It can be calming to the skin. Oatmeal can be calming. So, it's a lot, but I think it's definitely doable to find. There are a lot of great over-the-counter products. Neutrogena has, one of my colleagues has recommended. Their Hydra Boost line is very nice. La Roche-Posay, CeraVe, Cetaphil, they all have great products.
Awesome, thank you. And actually, that made me think of a follow-up question, which may be helpful, which is aging skin, are the things that it needs different? Because she emphasized that she's 50. Like, do the needs of the skin change at that point? or is it just
Yeah.
more of certain things?
Yeah, I heard the acne, I think. So in terms of aging, absolutely, I'm right there, so I understand that. In terms of the aging process, we definitely want to step it up, and we've all talked about what to do. Sunscreen, antioxidants, and retinoids, retinol at night. That's the pillar, that's the foundation of anti-aging. So we're definitely going to start there. La Roche-Posay, they have a vitamin C, they have a retinol that you can buy. They have sunscreens that you can buy. So the short answer is you can just start right there until you meet us in the aesthetic office or the dermatology office. Then we can step up your game. In my opinion, in your 50s, you should be straight into the medical office anyway. Over-the-counter products, you have surpassed that, in my opinion. You need to come in so that we can redeem some time. We don't waste your time. We just want to go all in the 50s.
Okay, awesome. Don't waste any time. Awesome. Thank you. Thank you. So Dr. Davis, I want to ask this next question of you. Someone wrote in and asked, how important is the type of makeup I put on my skin to my skin's health?
So that's very important. I mean, we are at a skin health conference, and so anything you put on your skin is going to be important to your skin health because it can help promote your skin health, or, if it's something that's not appropriate for your skin, it could work against your skin health. With makeup, there's a lot of different makeup brands out there. I usually always recommend to patients to look at makeup lines that are going to be non-comedogenic because I don't want it to clog their pores. I don't want it to result in acne breakouts. Of course, I tell them to, there's a lot of different makeup lines. Sometimes I like some of the powder-based ones, sometimes a little bit more than the creams if they have like really oily skin, because I'm just thinking about maybe it not clogging their pores. But I will usually, have them kind of check out just some of the different makeup lines, maybe look at some of their ingredients, because I think there's a lot of good ones out there. More importantly, if you're going to be wearing makeup is going to be, of course, what's happening with your makeup when it's time to go to bed, which is going to be taking it off every evening, cleaning your skin, making sure you're getting your skin clean. I mean, I agree. Sometimes I will use a makeup wipe, but that's my first step. And then I'm going into my cleanser to really make sure I'm getting my skin clean. I don't personally have a favorite makeup line. I think there's a lot of good ones out there. It's just making sure that for your skin type, whether it's oily or dry, you're getting products that are going to help not break your skin out.
Awesome. Cool. Thank you so much. The next question I want to ask is of Dr. Darji. So someone wrote in and asked, what's the best way to resolve issues with enlarged pores?
This is a common question.
Yeah.
We all have pores. So pores are basically the opening of hair follicles, and oftentimes your hair follicles are also associated with sebaceous glands. Sebaceous glands produce sebum or oil that your skin just naturally produces. Some people have pores that are more prominent than other people, and so we cannot get rid of our pores, but there are ways to help maybe minimize the appearance of them. So kind of talking about the double cleansing method that I think that several of us have discussed already. So, using cleaning your face with water and a cleanser, and then also using an oil or water-based cleanser is important. So, like I said, I use micellar water. I love using it as a second item in my cleansing routine. Wearing sunscreen actually also helps with this because UV damage helps to break down collagen, and collagen helps to keep your pores tight. And so wearing sunscreen to help protect against that is super important. Moisturizing. So oftentimes, you think, well, I have oily skin. I don't want to moisturize. I don't want to add a moisturizer to my skin. The problem with that is that if you don't moisturize, if you keep your skin dry, then your oil glands will compensate and produce more oil, essentially. And so it's important to moisturize. So moisturize every day, moisturize in the morning. I like to moisturize at night too. And then we talked about alpha hydroxy and beta hydroxy acids. So using those, I like to use like a AHA or BHA wash once to twice a week. And I feel like that helps to chemically exfoliate. I am going to say that apricot scrubs that you use to physically, exfoliate your skin, none of us probably recommend. So, can we raise our hands, everybody, or do we agree with that? So, something that's a chemical exfoliant is super helpful. So something with alpha hydroxy acids or beta hydroxy acids help to minimize your pore appearance. Topical retinoids or topical retinols, like we discussed at night, once again help to increase cell turnover. They also help to minimize the appearance of pores. And then something that I like to say is wearing a primer underneath your makeup is important. It helps as a barrier. It prevents foundation from, getting kind of deep into those pores. So I like wearing a primer. There's different ones out there. If you have dry skin, there's hydrating ones out there. If you have oily skin, there's kind of like a matte look primer out there as well. So that's important. And then finally, seeing a dermatologist is really something that can help to advance your management. So there's lasers out there that can help you. There's, things like microneedling. In-office chemical peels can be helpful too. So a range of things, depending on where you are on the spectrum, you can kind of start off doing a few things at home and then come see a dermatologist afterwards.
Awesome, thank you. And Dr. Rambia, Dr. Darji just mentioned like physical and chemical exfoliants as a help here. Can you just, for people who may not know what the difference is, can you say what the difference is between chemical and physical exfoliants?
Yeah, so physical exfoliant is like the one Dr. Darji was alluding to, the infamous Nile apricot scrub that people will use on their face to kind of scrub off their skin cells to reveal brighter skin. The problem is this is extremely, extremely irritating. I think everybody on this panel will agree with me that you should throw that away if you have that in your makeup cabinet. A chemical exfoliant, these include alpha hydroxy acids, beta hydroxy acids, like glycolic acid, lactic acid, salicylic acid. These all work at various layers of the skin to kind of slough off dead skin cells and reveal the newer skin cells at the surface. One that I really like and use is the Ordinary Makes a Glycolic Acid Toner. It's 7% glycolic acid. I use it every couple days, and I find that it has helped me as a chemical exfoliant that's pretty gentle.
Awesome, great, thank you. The next question is for Dr. Davis. So, people have talked about sunscreen all day, but this person wants to know, does the percentage of zinc oxide in your sunscreen matter? And if so, what's the minimal percentage for darker skin that you recommend?
That's an interesting question, and I may have to actually poll Dr. Clay and Dr. Mitchell or Dr. Kaga to see if they know. Different sunscreens are going to have different percentages. I don't necessarily personally think that it matters the percentage of the zinc oxide. It's more so if you're applying it and reapplying it. I mean, zinc oxide is one of the physical ingredients in sunscreens. So again, it's a physical blocker that sits on the skin. I personally prefer physical sunscreens. So those are the ones that I recommend for my patients. I think more so importantly, it's making sure that overall the SPF is 30 or higher and making sure that you're reapplying. But if any of the other derms have any thoughts, Dr. Mitchell, I don't know if you have any thoughts. I'd love to hear.
I absolutely agree with you, Dr. Davis. On average, most of the products that we recommend that are physical sunscreens are going to be about 10, 11, 12% zinc oxide. But other than that, I think that's just, what do you think, Dr. Kaga?
Yeah, I agree with you. I focus more on the SPF. I think that's the most important. And some of the physical sunscreens combine other, components or will mix with titanium dioxide as well. So,
right.
Yeah, I think the main thing that patients should look for is making sure it's at least SPF 30 when deciding.
I'll jump in really quick. And one thing with the zinc is sometimes, again, people with darker skin, they don't like the zinc because of the white paste that it might leave on the skin. Well, first of all, there are a lot of different variety of sunscreen, and there are ones that are micronized zinc, and they go much better on the skin. And then also, if you look for the sunscreen that are tinted, again, especially for us with brown or darker skin, it's almost like a foundation. I almost never wear foundation, but I'll wear a tinted sunscreen, which also has a zinc oxide in it, and that does the work of a sunscreen as well as a little bit of a color to your face.
And that's a great point. And sometimes what I'll also recommend for patients with some of the different tinted sunscreens, if it doesn't match them completely, or if it's one where they do like it, but it still doesn't blend in well, then sometimes I will recommend they can mix it with their moisturizer in the palm of their hand and put those two on together. And I think that's okay. I don't necessarily say every product that you're using, your serum, your this, your antioxidant, your sun, I don't say put them all on at once. But I do think you can take your sunscreen and mix it a little bit with your moisturizer, and I do think it blends on a little bit better. Someone on the panel also mentioned previously, Dermablend has come out with a product called Flawless Creator, which is nice because it has a higher percentage of iron oxide in it, and you can purchase it at Sephora or Ulta. It's non-comedogenic, but it comes in, I think, like 20 different colors. So you can sometimes go and find one that matches your skin the best. And I describe it as like skin pigment, little drops, skin tint, whatever you want to call it. But you can take a couple of drops of the Flawless Creator, put that on with your sunscreen, and I think that goes on nicely as well. So there are a lot of options. Sometimes you just have to be creative and look and find. But I do think that now more lines and companies are getting better at giving us more options for skin of color.
And I also think too that I think, and you guys kind of chime in, I think the products that are just strictly the zinc oxide without the titanium dioxide do better with not giving that cast to the skin when the product is applied. And so I find that a lot of my patients prefer the products that are just strictly the zinc oxide, micronized zinc oxide too. So I try to leave off that titanium. When I see that, I get a little bit nervous that it may make me look ghostly.
Which products are there a couple that you really like, Dr. Hope?
I really like Isden. I agree with I love Isden, and I think that's really one of the best. And I like Color Science. I like their Sun Forgettable, I think it is. I think that's a really nice one too.
Yes.
Awesome. Thank you guys, all of you, for weighing in. There's a bunch of questions coming in on the Q&A, so I'm gonna pull some of these out that we haven't gotten to yet. So Jasmine, would you be able to answer? Someone asked how to recover from the allergy caused by excess sweating. So maybe from working out or just sweating in general.
In terms of how to recover from allergy caused by excessive sweating, I know that some people will get, and maybe the dermatologist will need to weigh in on this one too, because I'm not great when it comes to allergies. These shots, depends on where you're getting them, especially like in your armpits or so. I will also make sure that you're wiping and cleansing really well afterwards, keeping wipes or anything with you. I'm gonna have someone else chime in too with this one, just so they can get a better answer.
Yeah, does anyone else want to weigh in on that question?
I could weigh in. I usually suggest that my clients always wear a headband, a sweatband, when they're working out, because a lot of times the sweat can really irritate the face, and depending on if they have any existing skin conditions, that can be really irritating. It can also be the fact that right after working out, instead of going home and cleansing their face, they're going to run errands, and so that sweat is just sitting. So I always suggest at least to take a white cloth and wet that and just wipe the face down if they're not going straight home to do their skincare routine, and make sure they're not working out in actives. So don't do your skincare routine and then go work out. You just want to cleanse your face and put your sunscreen on, then go work out and come home and do your routine. Because a lot of times I've had clients that think, oh yeah, I put my serum on and then I worked out like an hour later. So they just don't know. So a little bit of education sometimes helps.
Awesome. Thank you guys, all of you. Does anyone else want to weigh in, or should I go to the next question? Okay, I'm going to go to the next one. So This one, someone just wrote in the Q&A, what are the best products to treat hyperpigmentation on the lips? Dr. Clay, do you want to answer this one?
Sure. Number one, sunscreen. So always get a lip balm. I know, surprise. A lip balm that that contains SPF or has some form of SPF factor. And actually, as Dr. Diane discussed with the pigment drops, you can actually put on your lip balm with sunscreen, and then you can still wear lipstick because that is pigment, and that's going to help to block that ultraviolet exposure that could make your hyperpigmentation darker. Also, just taking it back a step, what's causing the hyperpigmentation on the lips? So if it's something that's genetic or acquired, it may not be treatable. So keep that in mind. Is it from smoking or from tobacco use that's causing it? Is there some product that you're using on your skin that you're allergic to that's causing hyperpigmentation? So definitely wanting to think about the underlying factors, because we can't treat it if we can't stop it from kind of constantly recurring. And then, lasers can be used on the lip by a dermatologist or someone who has been specially trained to do so. And then topical products can be used. So topical prescription products under the very, very safe care of a dermatologist can be used, like pigment brighteners, such as the acids that we've all discussed earlier. And then also hydroquinone can be used in higher percentages to fade or to bleach darker spots on the lips, probably for very, very short amounts of time. So those are some of the things that can commonly be done.
Awesome, thank you. Another one I see in here, someone said, is it good to use coconut oil on your face or body? I'm pretty sure anyone can weigh in on that. Does anybody want to take that one?
Not on your face.
Not on your face.
I just replied to that one. Yeah, definitely. It clogs the pores on your face and makes you more prone to acne. So definitely not on your face. On your body, it's all right unless you're prone to getting, again, acne or acne on your chest. But yeah, not on your face.
Awesome, thank you. So another person asked, this is an interesting one. They lost weight and stopped birth control around the same time and noticed a significant change in under eyes. And I think we talked about this a little bit before, but they want to know if they should consider filler or continue with a different plan. Interesting. Does anybody want to weigh in on filler for under eye darkness?
Yeah, so again, if done, so you have to be careful, where you go to get that done, because that's, again, a very high risk area. There's a lot of blood vessels there, and you can easily bruise there. So you have to go to a dermatologist who has a lot of practice doing the fillers in that area. Another thing that I've seen actually is very effective for dark circles in that area is actually PRP injections over there, and some good results. But again, should go to someone that does this on a routine base and is comfortable doing this, because there are risks associated with it.
So I'll speak to this because I actually just got filler in my tear troughs done on Wednesday for that exact reason, because I have dark circles under my eyes just genetically. There is no magic cream for that. I think we've spoken to that before. And I do have a little bit of puffiness right now. It's a little bit sensitive. But for me, I naturally, the way that my eyes look, they are more concaved. So it did just kind of help repair some of the volume in that area. Personally, I love it. But I decided to go that route because it's genetic. My mom has it. My sister has it. We all look that way. So just went in there and did it. But I'm sure dermatologists could speak to this more. There are definitely side effects. There's definitely swelling, potentially bruising. And so you really want to make sure you're going to a provider who knows what they're doing, so you're safe.
Awesome. So one other question that people had was, and I know Dr. Paul just mentioned it briefly, but should we consider PRP for hair restoration in African Americans, especially around the hairline? So I think I've talked to Dr. Mitchell, Dr. Davis, all about this. So either of you or both of you, if you'd like to weigh in.
I'm just going to say absolutely. It works very well. And I think all of us on this conference have, have at least educated our patients about it. I certainly have done it in my office, and I'm sure we all have done it. It works very well, but I will say, guys, that hair loss is multifactorial. There are multiple, when you come in for a hair loss consultation, we're not losing hair because of one reason. So it's really important to start with the consultation, and the treatment plan will therefore be multifactorial. Okay, so this is just one component of the treatment plan. There'll be other things that we do, but PRP definitely is part of the discussion for hair loss. So I'm all thumbs up with PRP.
And if you're experiencing hair loss, get in as early as you can. That's the other piece. Try to get in and see someone to have your scalp evaluated, have it looked at, get a diagnosis. So that way you don't, lose time trying to figure out everything else and whatnot before you can get it treated and addressed appropriately.
Awesome. Thank you guys so much. There's a bunch more questions, but we're kind of running out of time here. So maybe we'll save them for another day. I'll save this so we can all have it later. But thank you guys so much. It's been really fun. And these experts, you can in your home give a round of applause for them because they've been awesome, giving us so much wisdom. And I know I've been taking notes. So I just want to thank everybody for coming today and spreading the word with your friends. And I'm so passionate about the Beauty of the Nile community and creating space where brown skin is really celebrated and highlighted and cared for and just really loved in all shades of brown. And I think we can all relate to that. So love your brown skin. That's definitely the mission. So I just want to thank you for being here, and a huge thank you to the panelists. And if you want to keep up to date on future events or giveaways and tips from experts like these from women of color, you can head to beautyofthenile.com to sign up for the newsletter, or you can follow us on Instagram and Twitter at Beauty of the Nile. And the last thing I want to do is I want to announce the winners of our contest, who will get a free 20-minute skin consultation with one of our expert estheticians, which I'm jealous that I can't win. So it's either going to be Allie or Jasmine or Sylvia. And I'll announce your name. And then I'll follow up with each winner and esthetician in the coming days. So present the prize and help facilitate everyone's scheduling. So I'm just going to read out the winners' names now. So first winner is Alicia Davis. The second one is Gabrielle Span. Third, Granisha Young, Grace Okpali, Nadine Dorsonville, Jacinta Kay, Stacy Lambert, Jacqueline Carrington, and Courtney Sykes. So congratulations, and keep an eye on your email for a free ebook, which every attendee is going to get, with skin tips from experts of color on how to best care for your skin of color. This has been Jasmine Mobley with Beauty of the Nile, and remember to love your brown skin. Thank you so much, everybody. Bye, guys. Thank you so much. You were amazing. Thank you guys for being here.
This is Jasmine Mobley, and you've been listening to the Beauty of the Nile podcast. Beauty of the Nile is your space for skin tips, makeup tricks, inspiration, and motivation. We are here to celebrate and highlight our skin's beauty. Say it with me. Love your brown skin. Be sure you catch the next episode's amazing guests who will be dropping gems. For fabulous beauty inspiration, especially for brown skin, get our free newsletter subscription at beautyofthenile.com. We cannot wait to connect and share with you. Until next time, enjoy life.